Question 1. The control framework reveals that in diagnostic radiography, understanding the fundamental interactions of ionizing radiation with matter is paramount for optimizing image quality and minimizing patient dose. When considering the processes that contribute to both image formation and image degradation, which of the following statements best reflects the practical implications of these interactions in a typical X-ray examination? Option A. Photoelectric absorption is the dominant interaction at higher kVp settings, leading to increased scatter and reduced image contrast. Option B. Compton scattering contributes significantly to patient dose and image noise by producing scattered photons that reach the detector, thereby degrading image contrast. Option C. Compton scattering is the primary interaction responsible for generating the contrast seen in diagnostic images, particularly in denser tissues. Option D. Increasing the filtration of the X-ray beam primarily reduces photoelectric absorption within the patient, leading to improved image resolution. Correct answer is C. Compton scattering is the primary interaction responsible for generating the contrast seen in diagnostic images, particularly in denser tissues. Explanation. Scenario analysis. This scenario presents a professional challenge where a radiographer must interpret the interaction of radiation with matter in a practical clinical context, specifically concerning image quality and patient dose. The challenge lies in understanding how different physical processes influence the final diagnostic image and the associated radiation exposure, requiring a nuanced application of theoretical knowledge to a real-world situation. Accurate interpretation is crucial for optimizing image acquisition protocols, ensuring diagnostic efficacy, while minimizing unnecessary radiation to the patient, which is a core responsibility under the Australian regulatory framework for radiation safety. Correct approach analysis. The correct approach involves understanding that Compton scattering is a significant contributor to scattered radiation within the patient and at the detector. This scattered radiation, while not contributing to the primary diagnostic information, increases overall patient dose and can degrade image contrast by adding unwanted signal. Therefore, implementing techniques to reduce scatter, such as collimation and appropriate use of anti-scatter grids, directly addresses the physical interaction of radiation with matter to improve image quality and reduce dose, aligning with the principles of ALARA, as low as reasonably achievable, as mandated by Australian radiation safety legislation and guidelines from the Australian Health Practitioner Regulation Agency, APRA, and the Radiation Oncology Medical Physicists Association, ROMSA. Incorrect approaches analysis. One incorrect approach focuses solely on photoelectric absorption as the primary mechanism for image formation. While photoelectric absorption is crucial for generating contrast in lower atomic number tissues and at lower photon energies, it is not the dominant interaction responsible for scatter that degrades image quality and increases dose in typical diagnostic imaging scenarios involving higher energies and denser tissues. Neglecting Compton scattering leads to suboptimal strategies for dose reduction and image enhancement. Another incorrect approach might suggest that increasing kVp will always improve image quality without considering the trade-offs. While higher kVp can increase photon penetration and potentially reduce patient dose for a given exposure, it also increases the proportion of Compton scattering relative to photoelectric absorption, which can degrade contrast if not managed appropriately. This approach fails to recognize the complex interplay of interactions and their impact on both dose and image quality. A further incorrect approach could be to assume that all radiation interactions within the patient are beneficial for image formation. This overlooks the detrimental effects of scattered radiation, which adds noise and reduces contrast, thereby hindering diagnostic accuracy and necessitating repeat exposures, which in turn increases patient dose. This demonstrates a fundamental misunderstanding of how radiation interacts with matter to produce a diagnostic image. Professional reasoning. Professionals should approach such situations by first identifying the primary radiation interactions relevant to the imaging modality and energy range. They should then consider how these interactions affect both the desired signal image formation and unwanted effects, scatter, dose. The decision-making process should involve evaluating available technical parameters and adjuncts, e.g., collimation, grids, filtration, based on their known impact on these interactions, ultimately aiming to optimize the balance between diagnostic image quality and patient radiation dose, in accordance with regulatory requirements and professional ethical obligations. Question 2. The monitoring system demonstrates an unexpected and significant deviation from the expected radiation output during an X-ray exposure, raising concerns about potential patient overexposure. Option A. Immediately cease the X-ray exposure and initiate a protocol for equipment malfunction investigation and technique review. Option B. Continue the X-ray exposure, assuming the monitoring system is providing erroneous data, and proceed with the examination as planned. Option C. Ignore the monitoring system's alert and complete the X-ray exposure without any interruption or investigation. Option D. Cease the X-ray exposure but immediately restart the procedure without investigating the cause of the monitoring system's deviation. Correct answer is A. Immediately cease the X-ray exposure and initiate a protocol for equipment malfunction investigation and technique review. Explanation. This scenario presents a professional challenge due to the potential for radiation overexposure to a patient during an X-ray procedure, which directly impacts patient safety and diagnostic quality. The radiographer must make a rapid, informed decision based on real-time monitoring data, balancing the need for adequate imaging with the ALARA, as low as reasonably achievable principle, a cornerstone of radiation safety in Australia. The correct approach involves immediate cessation of the X-ray exposure and a thorough review of the equipment and technique. This aligns with the radiation protection principles outlined in the Australian Radiation Protection and Nuclear Safety Agency, ARPANSA, guidelines and the RANSCER own professional standards, prioritizing patient safety by stopping a potentially harmful exposure and then investigating the cause demonstrates adherence to the ALARA principle and the duty of care owed to the patient. This proactive investigation ensures that future exposures are optimized and that equipment malfunctions are addressed promptly, preventing recurrence. An incorrect approach would be to continue the exposure despite the anomaly, perhaps assuming the monitoring system is faulty. This disregards the potential for actual overexposure and violates the ALARA principle. It also fails to uphold the professional responsibility to ensure diagnostic quality and patient safety, potentially leading to unnecessary radiation dose without a corresponding diagnostic benefit. Such an action could be considered a breach of professional conduct and may have implications under relevant Australian health regulations concerning radiation safety. Another incorrect approach would be to ignore the monitoring system's alert and proceed with the examination as planned, without any investigation. This demonstrates a lack of vigilance and a failure to respond to critical safety information. It neglects the fundamental responsibility to monitor and control radiation doses, potentially exposing the patient to higher than necessary radiation levels. This approach fails to meet the standards of professional practice expected of a radiographer in Australia, where proactive monitoring and response to safety indicators are paramount. A further incorrect approach would be to immediately stop the exposure and then restart the procedure without any investigation into the cause of the anomaly. While stopping the exposure is correct, failing to investigate the reason for the monitoring system's alert means the underlying issue, if real, remains unaddressed. This could lead to repeated overexposures or suboptimal image quality in subsequent procedures, failing to learn from the incident and improve practice. This approach does not fully embody the principles of continuous quality improvement and radiation safety management. The professional decision-making process in such a situation should involve 1. Immediate recognition and response to safety alerts. 2. Prioritization of patient safety by stopping the exposure. 3. Systematic investigation of the cause of the anomaly, consulting with senior staff or medical physicists if necessary. 4. Documentation of the incident and the actions taken. And 5. Implementation of corrective actions to prevent recurrence. This framework ensures that patient well-being and the integrity of diagnostic imaging are maintained, in accordance with Australian regulatory requirements and professional ethical standards. Question 3. The monitoring system demonstrates an unexpected density in the left upper lobe of the lung on a routine chest X-ray. Which of the following approaches best reflects a systematic and clinically responsible method for assessing this finding? Option A. Rely on the automated reporting software's assessment of the density and proceed based solely on its recommendation. Option B. Review the current X-ray for technical factors and artifacts. Compare with all previous chest imaging studies and consider the patient's clinical history before recommending further action. Option C. Immediately schedule a CT scan of the chest to further delineate the abnormality. Option D. Advise the referring clinician that the finding is likely an artifact and requires no further investigation. The correct answer is C. Immediately schedule a CT scan of the chest to further delineate the abnormality. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of imaging data leading to incorrect patient management. The monitoring system's indication of an anomaly requires a radiologist to exercise critical judgment, balancing the need for thorough investigation with the avoidance of unnecessary patient anxiety and resource utilization. The challenge lies in distinguishing a clinically significant finding from an artifact or benign variation, necessitating a systematic and evidence-based approach. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes patient safety and diagnostic accuracy, aligning with the principles of good medical practice and the ethical obligations of a radiologist. This includes a detailed review of the current imaging, comparison with prior studies to establish a baseline and assess change, and consideration of the patient's clinical context. This comprehensive review ensures that any identified abnormality is assessed within its appropriate clinical framework, minimizing the risk of overdiagnosis or underdiagnosis. Adherence to established imaging protocols and guidelines, as expected within the fellowship of the Royal Australian and New Zealand College of Radiologists, Fransker framework, is paramount. This systematic approach ensures that decisions are evidence-based and justifiable, upholding professional standards and patient trust. Incorrect approach is analysis. One incorrect approach is to immediately escalate to more complex or invasive imaging without a thorough initial assessment. This fails to adhere to the principle of judicious resource allocation and can lead to unnecessary patient exposure to radiation or contrast agents, as well as increased healthcare costs. It also bypasses the crucial step of comparing with prior imaging, which is fundamental for detecting change and assessing significance. Another incorrect approach is to dismiss the anomaly without adequate investigation, particularly if it deviates from typical appearances. This risks missing a clinically important finding, potentially leading to delayed diagnosis and suboptimal patient outcomes. It demonstrates a failure to apply due diligence and a lack of critical appraisal of the imaging data. A third incorrect approach is to rely solely on automated interpretation or algorithmic suggestions without independent radiological review. While AI can be a valuable tool, the ultimate responsibility for diagnosis rests with the qualified radiologist. Over-reliance on automated systems without critical human oversight can lead to errors due to limitations in AI algorithms or the presence of artifacts that the AI may misinterpret. This approach fails to meet the professional standards of independent radiological assessment. Professional reasoning. Professionals should adopt a structured decision-making process when faced with unexpected findings. This involves 1. Acknowledging the finding and its potential significance. 2. Systematically reviewing the imaging, including technical quality and artifacts. 3. Comparing with all available prior imaging. 4. Integrating the imaging findings with the patient's clinical history, symptoms, and other investigations. 5. Consulting with referring clinicians if necessary. 6. Formulating a differential diagnosis and recommending appropriate further steps, which may include further imaging, clinical follow-up, or biopsy, based on the assessed likelihood of pathology and potential impact on patient management. This iterative process ensures that decisions are informed, patient-centered, and aligned with best practice guidelines. Question 4. The monitoring system demonstrates a consistent trend of increased signal-to-noise ratio, SNR, in digital radiography images across multiple modalities, suggesting potential overexposure or suboptimal image processing. Which of the following actions best reflects a proactive and compliant approach to address this observation within the Australian regulatory framework? Option A. Adjust the display contrast and brightness settings on the viewing monitors to visually compensate for the perceived noise without altering imaging parameters. Option B. Immediately increase the kilovoltage, kVp settings for all examinations to compensate for the observed trend, assuming it indicates underpenetration. Option C. Document the trend in the equipment logbook, but defer any corrective actions until a significant number of repeat examinations are reported. Option D. Initiate a comprehensive review of the imaging protocols and image processing parameters for the affected modalities, consulting relevant quality assurance guidelines, and seeking input from medical physics where necessary. The correct answer is D. Initiate a comprehensive review of the imaging protocols and image processing parameters for the affected modalities, consulting relevant quality assurance guidelines, and seeking input from medical physics where necessary. Explanation. This scenario presents a professional challenge due to the inherent tension between maintaining optimal image quality for diagnostic accuracy and minimizing radiation dose to patients and staff. The monitoring system's data requires interpretation and action, demanding a nuanced understanding of radiological sciences principles and their practical application within the Australian regulatory framework governing radiation safety. Careful judgment is required to balance these competing demands effectively. The correct approach represents best professional practice because it directly addresses the observed deviation by initiating a systematic review of imaging protocols. This aligns with the principles of ALARA, as low as reasonably achievable, as mandated by the Australian Radiation Protection and Nuclear Safety Agency, ARPANSA, codes and standards, and state/territory radiation safety legislation. It prioritizes patient safety and staff protection by seeking to understand the root cause of potential overexposure or suboptimal image quality, thereby enabling targeted corrective actions. This proactive and evidence-based approach ensures compliance with regulatory requirements for quality assurance and dose optimization. An incorrect approach that involves ignoring the monitoring system's alerts is a direct contravention of regulatory obligations. It fails to uphold the ALARA principle and demonstrates a disregard for patient safety and staff protection, potentially leading to unnecessary radiation exposure and compromised diagnostic efficacy. This constitutes a significant ethical and regulatory failure. Another incorrect approach, such as immediately increasing exposure factors without investigation, bypasses the crucial diagnostic step of understanding the cause of the anomaly. This could lead to unnecessary dose escalation if the issue lies elsewhere, e.g., detector malfunction, processing errors, and fails to achieve optimal image quality, thereby undermining diagnostic confidence and potentially leading to repeat examinations, further increasing cumulative dose. This approach lacks a systematic, evidence-based methodology and is therefore professionally unacceptable. Professionals should employ a decision-making framework that begins with acknowledging and investigating all monitoring system alerts. This involves consulting relevant imaging protocols, equipment performance logs, and potentially seeking input from medical physicists or senior radiographers. The goal is to identify the cause of any deviation from expected parameters. Once the cause is understood, appropriate corrective actions can be implemented, which may include protocol adjustments, equipment recalibration, or further staff training. This systematic, iterative process ensures continuous improvement in image quality and radiation safety, adhering to both regulatory mandates and ethical responsibilities. Question 5. The performance metrics show a consistent decline in the turnaround time for reporting of urgent CT scans over the past quarter. What is the most appropriate next step to address this trend? Option A. Monitor the trend for another quarter to see if it resolves spontaneously before allocating resources to an investigation. Option B. Conduct individual performance reviews for all radiologists involved in reporting urgent CT scans to identify those contributing most to the delays. Option C. Immediately implement a new, advanced AI-powered reporting software that promises faster report generation, without prior validation of its impact on this specific metric. Option D. Initiate a comprehensive review of the reporting workflow, including potential bottlenecks in image acquisition, PACS access, and radiologist availability, to identify the root cause of the delay. The correct answer is D. Initiate a comprehensive review of the reporting workflow, including potential bottlenecks in image acquisition, PACS access, and radiologist availability, to identify the root cause of the delay. Explanation. Scenario analysis. This scenario presents a common challenge in radiology departments, identifying and addressing a decline in a specific quality metric. The professional challenge lies in moving beyond simply observing the data to implementing a systematic and effective quality improvement process. It requires a radiologist to balance diagnostic accuracy, patient safety, and departmental efficiency, all within the framework of established professional standards and regulatory expectations. The temptation to make quick, Isolated changes without understanding the root cause is a significant pitfall. Correct approach analysis. The correct approach involves a structured, evidence-based quality improvement methodology. This aligns with the principles of continuous quality improvement, CQI, mandated by professional bodies and regulatory frameworks in Australia, such as those promoted by the Royal Australian and New Zealand College of Radiologists, RANSCR, and the Australian Commission on Safety and Quality in Health Care, ACSCA. Specifically, it reflects a commitment to identifying the root cause of the performance issue, developing targeted interventions, and then monitoring their effectiveness. This systematic approach ensures that improvements are sustainable and address the underlying problems, rather than just the symptoms. It upholds the ethical obligation to provide high-quality patient care and maintain professional standards. Incorrect approaches analysis. Implementing a new, unproven technology without a thorough evaluation of its impact on the specific performance metric is a regulatory and ethical failure. It risks introducing new problems, increasing costs, and potentially compromising diagnostic accuracy or patient safety without a clear benefit. This approach bypasses the essential steps of root cause analysis and evidence-based intervention selection. Focusing solely on individual radiologist performance without considering systemic factors is also problematic. While individual accountability is important, quality issues often stem from workflow, equipment, or training deficiencies. A punitive approach without investigation can lead to a demoralized workforce and fail to address the true cause of the problem, thus violating principles of fair practice and effective quality management. Ignoring the trend and assuming it will self-correct is a direct contravention of the duty of care and professional responsibility. Radiology departments are expected to actively monitor and manage quality. Failure to address a declining metric can lead to suboptimal patient care, increased risks, and potential breaches of accreditation standards. This passive approach demonstrates a lack of commitment to quality assurance. Professional reasoning. Professionals facing such a situation should employ a decision-making framework that prioritizes systematic investigation and evidence-based action. This typically involves 1. Data interpretation. Understand the nature and significance of the performance metric decline. 2. Root cause analysis. Investigate potential contributing factors, e.g., changes in patient population, new protocols, equipment issues, staff training, reporting templates. 3. Intervention design. Develop targeted, evidence-based interventions to address the identified root causes. 4. Implementation and monitoring. Introduce the interventions and rigorously track their impact on the performance metric and other relevant indicators. 5. Review and refinement. Continuously evaluate the effectiveness of the interventions and make adjustments as needed. This iterative process ensures that quality improvement efforts are effective, efficient, and aligned with best practice and regulatory requirements. Question 6. Quality control measures reveal a significant streak artifact obscuring detail in a CT scan of the abdomen. The radiologist suspects a potential issue with the X-ray beam. Considering the physical principles of CT imaging, which of the following investigations is most appropriate to identify and rectify the artifact? Option A. Repeating the scan with a different patient positioning protocol. Option B. Examining the raw data for evidence of beam hardening or other photon attenuation anomalies. Option C. Increasing the radiation dose to improve image penetration. Option D. Reviewing the patient's medical history for any contraindications to contrast media. The correct answer is D. Reviewing the patient's medical history for any contraindications to contrast media. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging, where a technical artifact compromises image quality and potentially diagnostic accuracy. The professional challenge lies in balancing the need for timely patient care with the imperative to ensure diagnostic integrity and adherence to established quality standards. Radiologists must critically evaluate the source of the artifact and its impact on the diagnostic information, making a judgment that prioritizes patient safety and diagnostic reliability. Correct approach analysis. The correct approach involves a systematic investigation into the cause of the artifact, focusing on the physical principles of the imaging modality. This aligns with the fellowship of the Royal Australian and New Zealand College of Radiologists, RANSCR, examination's emphasis on understanding the fundamental physics underpinning imaging techniques. By identifying the specific physical principle that has been disrupted, e.g., beam hardening in CT, magnetic field inhomogeneity in MRI, acoustic impedance mismatch in ultrasound. The radiologist can implement targeted corrective actions. This proactive approach ensures that the imaging system is functioning optimally, thereby upholding the quality of diagnostic information provided to referring clinicians and ultimately benefiting patient management. This aligns with the Ransker commitment to maintaining high standards of practice and patient care through rigorous quality assurance and a deep understanding of imaging science. Incorrect approaches analysis. One incorrect approach would be to simply repeat the scan without investigating the cause. This is inefficient, exposes the patient to unnecessary radiation or scan time, and fails to address the underlying technical issue. It represents a failure in quality control and a lack of understanding of the physical principles, as it does not seek to rectify the root cause of the artifact. Another incorrect approach would be to proceed with reporting the scan despite the artifact, assuming it does not significantly impact the diagnosis. This is a serious ethical and professional failing. It compromises diagnostic accuracy, potentially leading to misdiagnosis or delayed diagnosis, and breaches the duty of care owed to the patient. It demonstrates a disregard for the fundamental principles of image interpretation and quality assurance mandated by professional bodies like the Ransker. A third incorrect approach would be to attribute the artifact to patient movement, without confirming this through image review or discussion with the technologist. While patient movement can cause artifacts, other physical phenomena can also lead to similar appearances. This approach is speculative and bypasses the necessary technical investigation, potentially leading to incorrect troubleshooting and a failure to identify and rectify the true cause of the image degradation. Professional reasoning. Professionals should approach such situations by first acknowledging the artifact and its potential impact. The next step is to engage in a systematic troubleshooting process, drawing upon knowledge of the specific imaging modality's physical principles. This involves consulting with the imaging technologist, reviewing imaging parameters, and considering common sources of artifacts specific to that modality. The decision to repeat, modify, or report the scan should be based on a thorough understanding of the artifact's nature and its implications for diagnostic confidence, always prioritizing patient safety and diagnostic accuracy in accordance with Ransker guidelines. Question 7. Assessment of the optimal fluoroscopic technique for a barium swallow examination in an obese patient, considering both diagnostic image quality and radiation dose minimization. Option A. Utilize continuous fluoroscopy with the highest available M and KVP settings to ensure rapid image acquisition and maximum detail, regardless of patient habitus. Option B. Prioritize patient comfort by using a high frame rate and extended fluoroscopy time, assuming that modern equipment inherently manages dose effectively. Option C. Maintain a standard frame rate and KVP and rely solely on post-processing to enhance image quality, without actively adjusting fluoroscopic parameters during the examination. Option D. Employ pulsed fluoroscopy at a reduced frame rate, optimize collimation to the esophagus, and adjust KVP and M to achieve adequate contrast and detail while minimizing patient and staff dose. The correct answer is D. Employ pulsed fluoroscopy at a reduced frame rate, optimize collimation to the esophagus, and adjust KVP and M to achieve adequate contrast and detail while minimizing patient and staff dose. Explanation. Scenario analysis. This scenario presents a common challenge in fluoroscopy where a radiographer must balance the need for diagnostic image quality with the imperative to minimize radiation dose to both the patient and themselves. The patient's body habitus and the complexity of the examination, e.g., contrast opacification, patient movement, directly impact radiation exposure. The radiographer's responsibility extends beyond simply acquiring an image. It involves active radiation protection measures, adhering to the principles of ALARA, as low as reasonably achievable, as mandated by the Radiation Protection Series, RPS, publications, particularly RPS 150 and RPS 151, which are foundational to radiation safety in Australia. The professional challenge lies in making real-time decisions that optimize image quality for accurate diagnosis while demonstrably minimizing dose, requiring a nuanced understanding of fluoroscopic equipment parameters and their impact on both. Correct approach analysis. The correct approach involves a systematic and informed adjustment of fluoroscopic parameters to achieve diagnostic image quality with the lowest possible radiation dose. This includes optimizing the pulse rate, e.g., using pulsed fluoroscopy instead of continuous, adjusting the frame rate, and selecting appropriate collimation. Furthermore, utilizing the lowest possible kVp that still allows for adequate contrast and detail, and adjusting the filtration can also contribute to dose reduction. The use of magnification should be judicious, as it often increases dose. The radiographer must also consider the patient's position and the distance of the image intensifier from the patient. This approach aligns directly with the principles of radiation protection outlined in Australian regulatory guidelines, which emphasize the optimization of exposure factors to achieve the diagnostic objective with minimal dose. It demonstrates a proactive commitment to patient and staff safety, reflecting best professional practice. Incorrect approaches analysis, an approach that prioritizes image acquisition speed over dose optimization, such as maintaining a high frame rate and continuous fluoroscopy without considering alternatives, fails to adhere to the ALARA principle. This is a direct contravention of the spirit and letter of radiation protection regulations in Australia, which require active measures to minimize dose. Another incorrect approach would be to consistently use the highest available M and kVp settings, assuming this guarantees the best image quality, without considering if lower settings could achieve the same diagnostic outcome. This demonstrates a lack of understanding of the interplay between exposure factors and dose, and a failure to optimize for ALARA. Failing to utilize collimation effectively, allowing the X-ray beam to extend beyond the area of interest, significantly increases scatter radiation and patient dose unnecessarily. This is a clear breach of radiation safety protocols and regulatory requirements. Ignoring the impact of patient positioning or failing to use appropriate shielding where indicated would also be professionally unacceptable, as these are fundamental aspects of radiation protection. Professional reasoning. Professionals should adopt a decision-making framework that begins with understanding the specific examination requirements and the patient's characteristics. This involves a thorough knowledge of the fluoroscopic equipment's capabilities and limitations. The process should involve 1. Assessing the initial exposure settings and their suitability. 2. Actively considering and implementing dose reduction techniques such as pulsed fluoroscopy, appropriate frame rates, and collimation. 3. Monitoring image quality in real time and making incremental adjustments to exposure factors as needed, always striving for the lowest dose that yields diagnostic information. And 4. Documenting any deviations from standard protocols and the rationale behind them. This iterative process ensures that both diagnostic efficacy and radiation safety are paramount, in line with Australian regulatory expectations. Question 8. Comparative studies suggest that while DNA double-strand breaks are a primary mechanism of radiation-induced cellular damage, the ultimate biological outcome is significantly modulated by the efficiency of cellular repair pathways. Considering this, which of the following best reflects the impact of varying dose rates on radiation-induced damage and repair mechanisms in the context of diagnostic imaging? Option A. The efficiency of DNA repair mechanisms is largely independent of the dose rate at which radiation is delivered. Option B. Lower dose rates allow for more effective DNA repair, potentially reducing the overall biological impact of a given total dose compared to the same dose delivered at a high dose rate. Option C. The primary focus in diagnostic imaging should be on the immediate cellular damage, with minimal consideration for the subsequent repair processes. Option D. High dose rates invariably lead to more extensive and permanent DNA damage, irrespective of the cellular repair capacity. The correct answer is B. Lower dose rates allow for more effective DNA repair, potentially reducing the overall biological impact of a given total dose compared to the same dose delivered at a high dose rate. Explanation. Scenario analysis. This scenario presents a professional challenge in interpreting complex biological responses to radiation, specifically concerning damage and repair mechanisms. Radiologists must integrate knowledge of cellular biology, radiation physics, and clinical outcomes to accurately assess risk and guide patient management. The challenge lies in distinguishing between transient cellular responses and potentially permanent damage, and in understanding how individual repair capacities can influence long-term effects. This requires a nuanced understanding beyond simple dose-response relationships, considering the biological variability inherent in radiation biology. Correct approach analysis. The correct approach involves a comprehensive assessment of radiation-induced damage and repair mechanisms, considering both the immediate cellular consequences and the potential for long-term biological effects. This aligns with the fellowship of the Royal Australian and New Zealand College of Radiologists, FRANSCR, emphasis on a thorough understanding of the scientific basis of radiology. Best professional practice dictates that radiologists should be able to critically evaluate the literature on radiation biology, understand the limitations of current knowledge, and apply this understanding to patient care. This includes recognizing that repair mechanisms are dynamic and influenced by factors such as dose rate, radiation quality, and cellular context. Ethical considerations, particularly regarding patient safety and informed consent, necessitate this deep understanding to minimize unnecessary radiation exposure and to accurately communicate potential risks and benefits. Incorrect approaches analysis, focusing solely on deterministic effects without considering stochastic processes and repair capacity, represents a failure to grasp the full spectrum of radiation injury. Deterministic effects are generally dose-dependent and have a threshold, whereas stochastic effects, like cancer induction, are probabilistic and may not have a clear threshold, with repair mechanisms playing a crucial role in mitigating their likelihood. Ignoring the impact of dose rate on repair efficiency is also problematic, as lower dose rates allow for more effective DNA repair, potentially reducing the overall biological impact compared to the same total dose delivered at a high dose rate. Overemphasizing the immediate cellular response without considering the long-term implications of unrepaired damage or the efficiency of repair pathways overlooks the fundamental principles of radiation carcinogenesis and other late effects. This demonstrates a lack of comprehensive understanding required for responsible radiological practice. Professional reasoning. Professionals should approach such scenarios by first identifying the core biological processes at play, DNA damage induction and subsequent repair. They must then consider how various factors dose rate, radiation type, cellular environment influence these processes. A critical evaluation of available scientific literature, including peer-reviewed studies on radiation biology and radiobiology, is essential. This knowledge should then be applied to clinical decision-making, such as optimizing imaging protocols to minimize dose while maintaining diagnostic quality, and in counseling patients about potential risks. The decision-making process should be guided by principles of ALARA, as low as reasonably achievable, and a commitment to evidence-based practice, ensuring that patient safety and well-being are paramount. Question 9. Process analysis reveals a situation where a patient presents for a plain film radiograph of the lumbar spine, requested for nonspecific low back pain. The referring clinician has not provided specific clinical details beyond this general indication. The radiographer notes that the patient is a young adult and the clinical indication is vague. Which of the following approaches best reflects the fundamental principles of radiation protection in this context? Option A. Immediately cancel the examination, as the indication is too vague to justify radiation exposure. Option B. Proceed with the standard lumbar spine radiography protocol, as the request has been made by a clinician. Option C. Engage with the referring clinician to clarify the specific clinical indications and explore alternative imaging options or dose reduction strategies before proceeding. Option D. Proceed with a reduced exposure technique, assuming this will adequately reduce the dose without impacting diagnostic quality. The correct answer is B. Proceed with the standard lumbar spine radiography protocol, as the request has been made by a clinician. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging, where the perceived benefit of obtaining a diagnostic image must be weighed against the potential harm from ionizing radiation. The professional challenge lies in applying the fundamental principles of radiation protection, specifically optimization, ALARA as low as reasonably achievable, and justification, in a real-time clinical setting. The radiographer must make a judgment call that balances diagnostic efficacy with patient safety, considering the specific clinical context and the patient's individual circumstances. Correct approach analysis. The correct approach involves a systematic assessment of the clinical indication, the patient's condition, and the available imaging techniques. This aligns with the fundamental principle of justification, which mandates that the benefit of a medical exposure must outweigh the detriment. Furthermore, it embodies the principle of optimization, ALARA, ensuring that radiation doses are kept as low as reasonably achievable without compromising diagnostic quality. This approach requires the radiographer to engage with the referring clinician to confirm the necessity of the examination and to explore alternative imaging modalities or techniques that might reduce radiation exposure while still achieving the diagnostic objective. This collaborative and evidence-based decision-making process is central to best professional practice as mandated by the Radiation Protection Act and associated guidelines in Australia, which emphasize patient safety and responsible use of ionizing radiation. Incorrect approach is analysis, an approach that prioritizes obtaining the image regardless of the clinical justification or potential for dose reduction, fails to uphold the principle of justification. This could lead to unnecessary radiation exposure, violating the core tenets of radiation safety legislation and ethical practice. An approach that immediately cancels the examination without consulting the referring clinician or exploring dose reduction techniques is also professionally deficient. Caution is warranted. A blanket refusal without due diligence can compromise patient care by withholding potentially necessary diagnostic information. This neglects the principle of justification and the radiographer's responsibility to facilitate appropriate medical imaging. An approach that relies solely on preset imaging protocols without considering individual patient factors or the specific clinical question demonstrates a failure to optimize. While protocols are important for consistency, they must be adaptable to individual needs to ensure ALARA is applied effectively. This approach risks delivering a higher dose than necessary for a particular patient or examination. Professional reasoning. Professionals should adopt a structured decision-making process that begins with a thorough understanding of the clinical indication. This involves questioning the necessity of the examination and considering the potential diagnostic yield. Next, the radiographer should assess the patient's individual factors, e.g., age, body habitus, pregnancy status, and explore all available optimization techniques, including adjustments to imaging parameters, use of shielding, or consideration of alternative imaging modalities. Collaboration with the referring clinician is crucial to confirm the justification and to discuss any identified concerns or potential modifications. This iterative process ensures that the decision to proceed with, modify, or defer an examination is based on a comprehensive risk-benefit analysis, adhering to regulatory requirements and ethical obligations. Question 10. To address the challenge of integrating a new advanced imaging modality into the radiology department, what is the most appropriate initial step to ensure patient safety and operational integrity? Option A. Implement the modality immediately and conduct a retrospective review of any incidents that occur. Option B. Conduct a comprehensive risk assessment and develop a detailed management plan before the modality is operational. Option C. Proceed with implementation and address any identified issues as they arise during routine use. Option D. Rely on the vendor's provided safety documentation and assume existing departmental protocols are adequate. Correct answer is B. Conduct a comprehensive risk assessment and develop a detailed management plan before the modality is operational. Explanation. Scenario analysis. This scenario presents a common challenge in radiology departments, balancing the need for efficient workflow and resource allocation with the imperative to ensure patient safety and quality of care. The introduction of a new imaging modality, while promising improved diagnostic capabilities, inherently carries risks related to equipment malfunction, staff training, protocol development, and potential for increased radiation exposure if not managed appropriately. The professional challenge lies in proactively identifying, assessing, and mitigating these risks before they impact patient care or operational efficiency, requiring a systematic and multidisciplinary approach. Correct approach analysis. The correct approach involves a comprehensive risk assessment and management strategy that is integrated into the implementation process. This aligns with the principles of quality and safety mandated by the Royal Australian and New Zealand College of Radiologists, RANSCR, standards, and the broader Australian healthcare regulatory framework, such as the Australian Commission on Safety and Quality in Healthcare, ACSCA, National Safety and Quality Health Service, NSQHS standards. A proactive risk assessment identifies potential hazards, evaluates their likelihood and impact, and develops control measures. This includes establishing clear protocols, ensuring adequate staff training, performing rigorous equipment testing, and implementing ongoing monitoring. This approach demonstrates a commitment to patient-centered care and adherence to best practice guidelines, minimizing the likelihood of adverse events and ensuring the safe and effective use of the new technology. Incorrect approaches analysis. Implementing the new modality without a formal risk assessment and management plan is a significant regulatory and ethical failure. This approach neglects the fundamental principles of patient safety and quality improvement, potentially leading to equipment failures, incorrect diagnoses, or increased radiation doses, all of which contravene RANSCR guidelines and the duty of care owed to patients. Relying solely on vendor assurances without independent verification of safety and efficacy is also problematic, as it outsources a critical aspect of risk management and may overlook specific departmental needs or local contextual factors. Furthermore, assuming that existing protocols are sufficient for a new modality is a dangerous oversight. Each new technology requires tailored protocols to ensure optimal image quality, diagnostic accuracy, and radiation safety, as stipulated by radiation safety legislation and RANSCR recommendations. Finally, delaying risk management until after the modality is in use is reactive rather than proactive, increasing the likelihood of harm and requiring more complex and costly remediation. This reactive stance is contrary to the principles of continuous quality improvement and risk minimization expected within the Australian healthcare system. Professional reasoning. Professionals should adopt a structured risk management framework, such as that outlined in the ACSCAC NSQHS standards, which emphasizes proactive identification, assessment, and control of risks. This involves a multidisciplinary team, including radiologists, radiographers, medical physicists, and administrative staff, to comprehensively evaluate potential hazards. The process should include a thorough review of the new technology specifications, potential failure modes, and the development of robust operational protocols. Staff competency and training must be rigorously assessed and addressed. Regular audits and performance monitoring should be established to ensure ongoing safety and effectiveness. This systematic approach ensures that patient safety and quality of care are prioritized throughout the introduction and ongoing use of new technologies, aligning with professional ethical obligations and regulatory requirements. Question 11. Governance review demonstrates that a radiology department is planning to acquire a new CT scanner with advanced spectral imaging capabilities. The department head is seeking advice on the most appropriate approach to ensure successful integration and compliance with Australian regulatory requirements. Which of the following approaches best addresses the implementation challenges? Option A. Conduct a thorough technical evaluation of the new scanner's spectral imaging capabilities. Develop and validate specific imaging protocols. Implement comprehensive staff training. And establish a robust quality assurance program aligned with our PANSA and TGA guidelines. Option B. Proceed with installation and rely on the manufacturer's standard operating procedures and basic staff orientation, assuming the new technology will automatically improve diagnostic outcomes and adhere to all safety standards. Option C. Focus solely on the cost-effectiveness of the new scanner, assuming that any technical or safety concerns can be addressed reactively through ad hoc adjustments as issues arise during routine use. Option D. Prioritize rapid deployment to meet patient demand, deferring detailed protocol optimization and extensive staff training until after the scanner is fully operational and initial patient throughput is achieved. The correct answer is B. Proceed with installation and rely on the manufacturer's standard operating procedures and basic staff orientation, assuming the new technology will automatically improve diagnostic outcomes and adhere to all safety standards. Explanation. Scenario analysis. This scenario presents a common implementation challenge in medical imaging departments, balancing the adoption of new technology with existing operational and regulatory requirements. The challenge lies in ensuring that the introduction of a new CT scanner, with its potentially different physics and technological characteristics, does not compromise patient safety, diagnostic image quality, or compliance with Australian regulatory standards for radiation safety and medical device use. Radiologists, as clinical leaders, must navigate these complexities, considering not only the technical specifications, but also the practical implications for workflow, staff training, and quality assurance. Correct approach analysis. The correct approach involves a comprehensive, multifaceted strategy that prioritizes patient safety and diagnostic efficacy within the Australian regulatory framework. This includes rigorous pre-implementation assessment of the new scanner's technical specifications against established benchmarks and Australian standards, e.g. ARPANSA codes, TGA guidelines, necessitates a thorough review of the manufacturer's specifications, validation of performance through phantom studies and initial patient scans, and the development of new or updated imaging protocols tailored to the specific hardware. Crucially, it requires comprehensive staff training on the new technology, including its operational nuances and safety features. Establishing a robust quality assurance program, including regular performance checks and dose monitoring, is essential for ongoing compliance and optimal patient care. This approach aligns with the ethical obligations of medical professionals to provide safe and effective care and the legal requirements under Australian law to operate medical equipment responsibly and in accordance with regulatory guidance. Incorrect approaches analysis. Implementing a new CT scanner without a thorough technical validation and protocol optimization process is a significant regulatory and ethical failure. Relying solely on manufacturer claims without independent verification can lead to suboptimal image quality, increased radiation doses to patients, and potential misdiagnosis, violating the duty of care. Failing to update or develop appropriate imaging protocols for the new hardware can result in inconsistent diagnostic performance and noncompliance with dose optimization principles mandated by radiation safety regulations. Neglecting comprehensive staff training on the new technology poses a direct risk to patient safety and operational efficiency. Inadequate or absent quality assurance measures mean that deviations from expected performance or safety standards may go undetected, leading to ongoing breaches of regulatory requirements and compromising patient care. These failures can have serious consequences, including potential disciplinary action from the Medical Board of Australia, legal liabilities, and damage to the institution's reputation. Professional reasoning. When faced with the implementation of new medical imaging technology, professionals should adopt a systematic and evidence-based approach. This involves 1. Understanding the regulatory landscape. Familiarize yourself with relevant Australian regulations, including those from the Therapeutic Goods Administration, TGA, for medical devices, and the Australian Radiation Protection and Nuclear Safety Agency, ARPANSA, for radiation safety. 2. Technical due diligence. Critically evaluate the technical specifications of the new equipment and compare them against established benchmarks and your institution's needs. 3. Protocol development and validation. Develop and rigorously test new or updated imaging protocols to ensure optimal image quality and radiation dose efficiency. 4. Staff education and competency. Ensure all relevant staff receive adequate training and demonstrate competency in operating the new equipment and adhering to new protocols. 5. Quality assurance and ongoing monitoring. Establish and maintain a robust quality assurance program to continuously monitor equipment performance, image quality, and radiation doses. 6. Risk management. Proactively identify and mitigate potential risks associated with the new technology. Question 12. Strategic planning requires a proactive approach to adopting new imaging technologies. A new technique promises significantly improved image resolution, potentially leading to earlier detection of subtle pathologies. However, preliminary data suggests that achieving this resolution requires a higher radiation dose compared to current standard protocols. Considering the known principles of radiation dose-response relationships, what is the most ethically and professionally sound approach for a radiology department to take when evaluating the potential adoption of this new technique? Option A. Reject the new technique outright due to the increased radiation dose, opting to continue with existing, lower-dose protocols regardless of potential diagnostic limitations. Option B. Conduct a comprehensive review of the scientific literature to understand the specific dose-response curve for this technique, critically evaluate the evidence for its diagnostic superiority, and perform a rigorous risk-benefit analysis in consultation with referring clinicians before considering adoption. Option C. Implement the new technique immediately, prioritizing the potential for enhanced diagnostic accuracy and image quality above all other considerations. Option D. Adopt the new technique on a trial basis for a limited number of patients, relying solely on the anecdotal positive experiences of colleagues in other institutions to justify its use. The correct answer is C. Implement the new technique immediately, prioritizing the potential for enhanced diagnostic accuracy and image quality above all other considerations. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing the potential benefits of a new imaging technique, which may offer improved diagnostic accuracy, against the known risks associated with radiation exposure. The dose-response relationship is central here. While higher doses might yield better image quality, they also increase the probability of stochastic effects like cancer. Radiologists have a professional and ethical obligation to minimize radiation dose to patients while achieving diagnostic efficacy, a principle known as ALARA, as low as reasonably achievable. The dilemma is amplified when considering the potential for a dose-response relationship that is not linear or has a threshold, meaning that even low doses might carry some risk, or that a certain threshold must be exceeded before a significant increase in risk is observed. This uncertainty necessitates careful consideration of the evidence and a commitment to patient safety. Correct approach analysis. The correct approach involves a thorough review of the available literature and evidence regarding the specific dose-response relationship for the proposed imaging technique. This includes understanding the known risks at various dose levels, the diagnostic benefits offered by the technique, and comparing these to existing, lower-dose alternatives. If the evidence suggests that the proposed technique offers a significant diagnostic advantage that cannot be achieved with lower doses, and that the increased dose is justified by the potential clinical benefit, e.g., earlier cancer detection, improved treatment planning, then its adoption may be considered. This aligns with the Ransker commitment to evidence-based practice and patient-centered care, ensuring that any increase in radiation exposure is clinically justified and minimizes harm. The decision-making process should be documented and transparent, involving consultation with referring clinicians and, where appropriate, patient consent. Incorrect approaches analysis. One incorrect approach would be to adopt the new technique solely based on the promise of improved image quality without critically evaluating the dose-response data. This fails to uphold the ALARA principle and the ethical duty to minimize radiation risk. It disregards the potential for stochastic effects, even if the exact dose-response curve is not fully elucidated. This approach could lead to unnecessary radiation exposure for patients, violating professional standards and potentially Ransker guidelines on radiation safety. Another incorrect approach would be to reject the technique outright due to any perceived increase in radiation dose, without considering the potential diagnostic benefits. This could lead to missed diagnostic opportunities or suboptimal patient care if the new technique offers a significant advantage over existing methods. It fails to engage with the nuanced understanding of dose-response relationships, where a carefully considered increase in dose might be justified by a substantial improvement in clinical outcomes. This approach prioritizes dose reduction over diagnostic efficacy without a proper risk-benefit assessment. A third incorrect approach would be to rely on anecdotal evidence or the opinions of colleagues without consulting peer-reviewed literature or established guidelines. This bypasses the rigorous scientific evaluation required for adopting new technologies and could lead to the implementation of practices that are not evidence-based, potentially exposing patients to undue risk or failing to provide optimal care. This demonstrates a failure to adhere to the principles of evidence-based medicine and professional responsibility. Professional reasoning. Professionals should employ a systematic decision-making process that begins with identifying the clinical question and the potential role of the new imaging technique. This is followed by a comprehensive literature search to understand the dose-response relationship, diagnostic efficacy, and safety profile of the technique. A thorough risk-benefit analysis must be conducted, comparing the proposed technique with existing alternatives. Consultation with referring physicians and, if necessary, patient discussion regarding risks and benefits is crucial. The decision should be based on robust evidence and aligned with professional guidelines and ethical principles, with clear documentation of the rationale. Question 13. The assessment process reveals that a radiographer is performing abdominal CT scans for suspected appendicitis. The radiographer consistently uses a protocol that delivers a relatively high dose but produces images with very low noise and excellent detail, even for larger patients. The radiologist has noted that while the images are visually impressive, the diagnostic yield for appendicitis is not significantly improved compared to scans performed with a lower dose protocol that has been validated for this indication. The radiographer expresses a preference for this high-dose protocol, believing it represents the highest standard of image acquisition. Which of the following approaches best reflects the principles of radiation dose optimization in CT within the Australian regulatory framework? Option A. Reducing the radiation dose significantly by lowering the tube current time product, M, as to the absolute minimum achievable, even if it results in noticeable image noise that might obscure subtle findings. Option B. Continuing to use the current high-dose protocol, as the radiographer believes it provides superior image quality and represents the highest standard of care, regardless of the diagnostic yield for the specific indication. Option C. Implementing a generic, low-dose protocol for all abdominal CT examinations, without considering the specific clinical indication or patient factors, assuming this will universally reduce radiation exposure. Option D. Adjusting the CT acquisition parameters to align with validated, evidence-based protocols for suspected appendicitis, prioritizing diagnostic adequacy while minimizing radiation dose according to the ALARA principle, and seeking radiologist input for any necessary deviations. The correct answer is D. Adjusting the CT acquisition parameters to align with validated, evidence-based protocols for suspected appendicitis, prioritizing diagnostic adequacy while minimizing radiation dose according to the ALARA principle, and seeking radiologist input for any necessary deviations. Explanation. This scenario presents a common challenge in diagnostic imaging, balancing the need for diagnostic image quality with the imperative to minimize radiation exposure to the patient, as mandated by Australian regulatory frameworks such as the Radiation Protection Series, RPS, publications by ARPANSA, and state-based radiation safety legislation. The professional challenge lies in interpreting image quality subjectively while adhering to objective dose reduction principles, and ensuring that no diagnostic information is compromised. This requires a nuanced understanding of CT physics, anatomy, and pathology, coupled with an awareness of the ALARA, as low as reasonably achievable principle. The correct approach represents best professional practice because it prioritizes patient safety through dose optimization without sacrificing diagnostic efficacy. This aligns directly with the fundamental ethical and legal obligations of radiographers and radiologists in Australia to protect patients from unnecessary ionizing radiation. It demonstrates a commitment to evidence-based practice and adherence to national guidelines, which are designed to ensure that radiation doses are kept to levels that are appropriate for the clinical indication and that provide the necessary diagnostic information. This approach reflects a mature understanding of the interplay between image quality and radiation dose, and the ability to make informed decisions based on clinical context. An incorrect approach that focuses solely on achieving the absolute lowest possible dose without considering diagnostic adequacy would be professionally unacceptable. This would represent a failure to meet the diagnostic requirements of the examination, potentially leading to missed pathology or the need for repeat scans, which would ultimately increase the patient's overall radiation burden and delay diagnosis. This contravenes the ALARA principle by failing to achieve the reasonably achievable diagnostic outcome. Another incorrect approach that prioritizes image acquisition parameters that inherently deliver higher doses, even if they produce subjectively better images, would also be professionally unacceptable. This demonstrates a lack of understanding or application of dose reduction techniques, and a disregard for the potential long-term risks associated with ionizing radiation, failing to uphold the duty of care to the patient. A further incorrect approach that relies on generic, unverified protocols without considering patient-specific factors or the specific clinical question would be a failure of professional judgment. Effective dose optimization requires tailoring parameters to the individual patient size, the anatomical region being scanned, and the diagnostic purpose of the examination, as guided by clinical indication and departmental protocols that are regularly reviewed and updated in accordance with regulatory requirements. The professional decision-making process for similar situations should involve a systematic evaluation of the clinical indication, followed by the selection of appropriate CT protocols that are known to provide diagnostic quality images at optimized dose levels. This includes considering factors such as tube current time product, M/S, tube voltage, kVp, pitch, and iterative reconstruction algorithms. Radiographers should be empowered to adjust parameters within established guidelines based on patient factors, and radiologists should critically review images for diagnostic adequacy and radiation dose, providing feedback for protocol refinement. Continuous professional development and engagement with ARPANSA guidelines and state radiation safety legislation are crucial for maintaining best practice. Question 14. Consider a scenario where a radiologist is reviewing CT scans of a patient requiring serial imaging for a chronic condition, necessitating repeated examinations over time. The imaging department has recently upgraded its CT scanner, offering both filtered back projection, FBP, and various iterative reconstruction, algorithms. The radiologist needs to select the most appropriate reconstruction technique for these follow-up scans, balancing the need for high diagnostic image quality with the imperative to minimize cumulative radiation dose to the patient. Option A. Select an iterative reconstruction algorithm that is known to significantly reduce image noise and artifacts, allowing for a reduction in radiation dose while maintaining or improving diagnostic image quality for serial assessment. Option B. Choose an iterative reconstruction, algorithm that offers the fastest reconstruction time, prioritizing workflow efficiency for the department, even if it introduces minor uncharacterized artifacts. Option C. Opt for an iterative reconstruction, algorithm that is known to produce highly detailed images but requires a higher radiation dose than standard filtered back projection FBP to achieve its optimal performance. Option D. Continue using filtered back projection, FBP, with standard reconstruction parameters, as it is a well-established technique that provides consistent image quality for comparison with previous scans. The correct answer is A. Select an iterative reconstruction algorithm that is known to significantly reduce image noise and artifacts, allowing for a reduction in radiation dose while maintaining or improving diagnostic image quality for serial assessment. Explanation: scenario analysis. This scenario presents a common challenge in diagnostic imaging, balancing image quality with radiation dose. Radiologists must critically evaluate the trade-offs inherent in different image reconstruction techniques, understanding that choices impact diagnostic accuracy and patient safety. The professional challenge lies in selecting the optimal technique that maximizes diagnostic information while adhering to the principles of ALARA, as low as reasonably achievable, and relevant Australian regulatory guidelines for radiation safety. This requires a deep understanding of the underlying physics and clinical implications of each technique. Correct approach analysis. The correct approach involves selecting an iterative reconstruction technique that offers a superior signal-to-noise ratio and reduced image artifacts compared to filtered back projection, particularly at lower radiation doses. Iterative methods leverage statistical models of the imaging process to refine the reconstructed image iteratively, leading to a more accurate representation of the underlying anatomy. This aligns with best professional practice by prioritizing diagnostic quality and patient safety, as mandated by the Radiation Protection Series, RPS, publications from ARPANSA, Australian Radiation Protection and Nuclear Safety Agency, which guide the safe use of ionizing radiation in medical imaging. By choosing a technique that allows for dose reduction without compromising diagnostic efficacy, the radiologist upholds their ethical and professional responsibility to minimize patient exposure. Incorrect approaches analysis. Using filtered back projection, FBP, without considering dose reduction is professionally unacceptable because it is a less advanced technique that inherently produces more noise and artifacts, especially at lower dose levels. To achieve comparable image quality to iterative methods, FBP often requires higher radiation doses, thereby failing to adhere to the ALARA principle and potentially contravening RPS guidelines. Selecting an iterative reconstruction algorithm that is known to introduce specific, clinically significant artifacts, even if it offers some dose reduction, is also professionally unsound. This would compromise diagnostic accuracy and patient care, violating the fundamental ethical duty to provide accurate diagnoses and the regulatory expectation that imaging techniques are appropriate for the clinical indication. Opting for a reconstruction technique solely based on speed of reconstruction, without adequate consideration of image quality and dose, is another failure. While efficiency is desirable, it must not supersede the primary responsibilities of diagnostic accuracy and patient safety, which are paramount in radiological practice and implicitly supported by regulatory frameworks promoting quality patient care. Professional reasoning. Professionals should approach such decisions by first identifying the clinical question and the anatomical region being imaged. Then they should consider the available reconstruction technologies and their known performance characteristics regarding image quality, noise, artifacts, spatial resolution, and radiation dose. Consulting departmental protocols, vendor-specific information, and relevant literature on image reconstruction techniques is crucial. The decision-making process should involve a risk-benefit analysis, weighing the potential diagnostic gains against the radiation dose and the possibility of image artifacts. Adherence to our PANSA guidelines and local radiation safety legislation is non-negotiable. If uncertainty exists, consultation with medical physicists or senior colleagues is recommended to ensure the most appropriate and safe imaging protocol is selected. Question 15. The investigation demonstrates an X-ray image with insufficient radiographic density and poor contrast, making it difficult to visualize subtle anatomical structures. The radiographer suspects underexposure. Which of the following technical adjustments would be the most appropriate initial step to correct this image quality issue while adhering to radiation safety principles? Option A. Increase the source-to-image distance, SID. Option B. Decrease the milliampere seconds, ms. Option C. Increase the kilovoltage peak, kVp. Option D. Increase the milliampere seconds, ms. The correct answer is D. Increase the milliampere seconds, ms. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging where the quality of an X-ray image is compromised, potentially impacting diagnostic accuracy and patient care. The radiographer must critically evaluate the image and understand the underlying physics of X-ray production to identify the cause of the artifact and determine the most appropriate corrective action. This requires not only technical knowledge, but also an understanding of the principles of radiation safety and efficient use of resources, as repeating an X-ray unnecessarily exposes the patient to additional radiation. The professional challenge lies in balancing the need for a diagnostically adequate image with the imperative to minimize radiation dose. Correct approach analysis. The correct approach involves identifying the specific artifact and correlating it with the principles of X-ray production. In this case, a clear indication of underexposure, such as a lack of sufficient radiographic density and contrast, points towards inadequate photon penetration or quantity. Understanding that kVp influences photon energy penetration, and m as influences photon quantity exposure, is crucial. If the image appears washed out or lacks detail in denser anatomical regions, it suggests insufficient photon quantity reaching the detector. Adjusting m as to increase the number of photons produced and subsequently reaching the detector, while maintaining an appropriate kVp for penetration, is the most direct and effective method to correct underexposure without significantly altering the beam's penetrating power. This aligns with the principles of ALARA, as low as reasonably achievable, by aiming for a diagnostic image with the lowest possible radiation dose, and it adheres to the professional responsibility of producing high-quality diagnostic images, as per the standards expected by the Fellowship of the Royal Australian and New Zealand College of Radiologists. Incorrect approaches analysis. Increasing kVp significantly without a corresponding adjustment to m, as would increase the penetrating power of the X-ray beam. While this might improve density, it can also lead to a loss of contrast and potentially overexpose less dense tissues, making subtle details harder to discern. This approach is less precise for correcting simple underexposure and can introduce new diagnostic challenges. It also deviates from the principle of using the lowest effective kVp for optimal contrast. Decreasing m, as would further reduce the number of photons, exacerbating the underexposure and rendering the image diagnostically useless. This is a direct contravention of the goal of achieving a diagnostic image and represents a failure in basic radiographic technique and radiation safety. Increasing the source-to-image distance, SID, would reduce the intensity of the X-ray beam reaching the patient and detector due to the inverse square law. This would necessitate a significant increase in M as to compensate, leading to a longer exposure time and increased potential for motion blur, as well as a higher overall patient dose. It is not a primary method for correcting underexposure in the manner described. Professional reasoning: radiographers should employ a systematic approach when evaluating image quality. This involves 1. Initial image assessment. Critically review the image for density, contrast, detail, and the presence of artifacts. 2. Artifact identification. Accurately identify the nature of the artifact, e.g., underexposure, overexposure, motion blur. Processing error. 3. Causal analysis. Relate the identified artifact to the fundamental principles of X-ray production, KVP, M as SID, filtration, beam quantity, and image receptor characteristics. 4. Corrective action planning. Determine the most appropriate technical adjustment to rectify the artifact while adhering to radiation safety principles, ALARA. 5. Documentation and communication. Record the adjustments made and communicate any significant findings or issues to the supervising radiologist. In this scenario, the systematic process would lead to the recognition of underexposure and the selection of M as the primary parameter to adjust for correction. Question 16. Upon reviewing the referral for a magnetic resonance imaging, MRI, examination of a patient with a known history of a metallic orthopedic implant, what is the most appropriate initial step to ensure patient safety and diagnostic efficacy? Option A. Immediately cancel the MRI examination and refer the patient for an alternative imaging modality without further investigation. Option B. Proceed with the MRI examination as scheduled, assuming the implant is MRI safe based on its commonality. Option C. Undertake a thorough investigation into the specific MRI compatibility of the metallic implant, consulting manufacturer guidelines or implant databases, and assess the potential impact of artifact before proceeding. Option D. Rely solely on the referring clinician's assurance that the implant poses no risk for MRI. The correct answer is B. Proceed with the MRI examination as scheduled, assuming the implant is MRI safe based on its commonality. Explanation: scenario analysis. This scenario presents a professional challenge due to the inherent risks associated with magnetic resonance imaging, MRI, and the need to balance diagnostic necessity with patient safety. The presence of a metallic implant in a patient undergoing MRI necessitates a thorough risk-benefit assessment, requiring the radiographer and radiologist to consider potential adverse events, such as device malfunction, heating, or movement, which could lead to patient harm. This requires careful judgment informed by current evidence and regulatory guidelines. Correct approach analysis. The correct approach involves a comprehensive pre-MRI assessment to identify and evaluate the metallic implant. This includes verifying the implant's MRI compatibility, e.g., by checking manufacturer documentation or implant databases, assessing the specific MRI sequence parameters, and considering the potential clinical impact of artifact. This aligns with the principles of patient safety and the duty of care mandated by professional bodies and regulatory frameworks in Australia, such as those overseen by the Australian Health Practitioner Regulation Agency, AHPRA, and guidelines from the Royal Australian and New Zealand College of Radiologists, RANSCR. It ensures that the diagnostic benefit of the MRI outweighs the potential risks and that appropriate safety precautions are implemented. Incorrect approaches analysis. Failing to investigate the MRI compatibility of the implant and proceeding with the scan without adequate information represents a significant breach of professional duty and regulatory requirements. This approach disregards the potential for serious harm to the patient, such as thermal injury or device malfunction, and is contrary to the principles of informed consent and patient safety. Demonstrates a lack of due diligence and adherence to established safety protocols. Assuming the implant is safe without verification is equally problematic. While many implants are MRI conditional or safe, this is not universally true. This assumption bypasses the critical step of risk assessment and could lead to unforeseen complications. It fails to uphold the professional standard of care, which demands a proactive and evidence-based approach to patient safety. Deferring the decision solely to the patient's referring clinician without engaging in the necessary radiological assessment is also an incorrect approach. While collaboration is essential, the responsibility for assessing MRI safety lies with the radiology department. The referring clinician may not possess the specific expertise regarding MRI physics and implant interactions required for this critical evaluation. Professional reasoning. Professionals should adopt a systematic approach to patient assessment for MRI. This involves 1. Identifying potential contraindications, including the presence of metallic implants. 2. Actively seeking information regarding the implant's MRI compatibility through patient history, medical records, and manufacturer data. 3. Conducting a thorough risk-benefit analysis, considering the diagnostic value of the MRI against potential risks. 4. Implementing appropriate safety measures and protocols based on the implant's characteristics and the planned MRI examination. 5. Documenting the assessment and decision-making process. This structured approach ensures patient safety, adheres to regulatory requirements, and upholds professional ethical standards. Question 17. Strategic planning requires a thorough understanding of the fundamental physical interactions of radiation with matter to optimize diagnostic imaging. Which of the following statements most accurately describes a key interaction relevant to diagnostic X-ray imaging and its significance? Option A. At the lower end of the diagnostic X-ray energy spectrum, the photoelectric effect is a dominant interaction mechanism, particularly in tissues with higher atomic numbers, contributing significantly to image contrast. Option B. The photoelectric effect becomes increasingly dominant over Compton scattering as X-ray photon energy increases within the diagnostic range. Option C. Pair production is a significant interaction that contributes to image formation in diagnostic X-ray imaging across all energy ranges. Option D. Compton scattering is the primary interaction responsible for generating contrast in diagnostic X-ray imaging, especially in tissues with low atomic numbers. Correct answer is A. At the lower end of the diagnostic X-ray energy spectrum, the photoelectric effect is a dominant interaction mechanism, particularly in tissues with higher atomic numbers, contributing significantly to image contrast. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a radiologist to critically evaluate the fundamental physical principles governing radiation interaction with matter, specifically in the context of diagnostic imaging. Understanding these interactions is crucial for optimizing image quality, minimizing patient dose, and ensuring the appropriate selection of imaging modalities. The challenge lies in discerning the most accurate and relevant explanation of these phenomena from a list of potentially plausible but ultimately incorrect statements, all within the strict confines of the Ransker exam scope. Correct approach analysis. The correct approach accurately describes the photoelectric effect as a dominant interaction mechanism at the lower end of the diagnostic X-ray energy spectrum, particularly in tissues with high atomic numbers. This is because the probability of photoelectric absorption is strongly dependent on the atomic number, Z3, and inversely proportional to the cube of the photon energy. This interaction is responsible for much of the contrast seen in X-ray images, as it preferentially absorbs lower-energy photons in denser materials. This aligns with the Ransker curriculum's emphasis on understanding the physics of image formation and dose reduction strategies. Incorrect approaches analysis. One incorrect approach might incorrectly attribute the primary contrast-generating mechanism at lower energies to Compton scattering. Compton scattering, while prevalent at higher diagnostic energies and in tissues with lower atomic numbers, is less dependent on atomic number and primarily results in scattered photons that degrade image contrast and increase patient dose. Relying on this as the primary contrast mechanism would demonstrate a fundamental misunderstanding of X-ray interactions relevant to diagnostic imaging. Another incorrect approach could misrepresent the energy dependence of these interactions. For instance, suggesting that Compton scattering dominates at lower X-ray energies or that photoelectric effect becomes more significant at higher energies would be factually incorrect and would lead to flawed clinical decision-making regarding imaging parameters and shielding. A further incorrect approach might oversimplify or mischaracterize the role of pair production. Pair production is a high-energy interaction, requiring photon energies 1.022 MeV. that is not significant in typical diagnostic radiology energy ranges, and therefore does not contribute to image formation or dose in this context. Including it as a relevant interaction for diagnostic X-rays would indicate a lack of understanding of the specific physics applicable to the Ransker examination scope. Professional reasoning. Professionals should approach such questions by recalling and applying the core principles of radiation physics as taught within the Ransker framework. This involves understanding the relative contributions of photoelectric absorption and Compton scattering across the diagnostic energy spectrum and their dependence on material composition. The decision-making process should involve systematically evaluating each option against established physical laws and their practical implications in diagnostic radiology, prioritizing accuracy and relevance to clinical practice. Question 18. Examination of the data shows a longitudinal ultrasound image of the gallbladder. A hyperechoic structure is noted within the gallbladder lumen, casting a distinct, dark shadow extending posteriorly from its edge. This shadowing is sharply defined and appears to completely obscure underlying tissues. Which of the following best explains the observed phenomenon? A. The posterior acoustic shadowing is indicative of calcified gallstones within the gallbladder. B. The posterior acoustic shadowing is caused by a simple cystic lesion within the gallbladder wall. C. The posterior acoustic shadowing is a result of a small gas bubble within the gallbladder lumen. D. The posterior acoustic shadowing is an artifact due to a malfunction of the ultrasound transducer. Option A. The posterior acoustic shadowing is a result of a small gas bubble within the gallbladder lumen. Option B. The posterior acoustic shadowing is indicative of calcified gallstones within the gallbladder. Option C. The posterior acoustic shadowing is an artifact due to a malfunction of the ultrasound transducer. Option D. The posterior acoustic shadowing is caused by a simple cystic lesion within the gallbladder wall. The correct answer is B. The posterior acoustic shadowing is indicative of calcified gallstones within the gallbladder. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic ultrasound, interpreting image artifacts. The professional challenge lies in distinguishing between genuine pathology and artifacts that can mimic disease, potentially leading to misdiagnosis, unnecessary investigations, or delayed treatment. Radiologists must possess a robust understanding of ultrasound physics to accurately identify and explain these phenomena, ensuring patient safety and optimal care. This requires critical thinking and the application of theoretical knowledge to practical imaging scenarios. Correct approach analysis. The correct approach involves accurately identifying the artifact based on its characteristic appearance and understanding the underlying physical principles that cause it. In this case, posterior acoustic shadowing is a well-recognized artifact caused by the attenuation or reflection of the ultrasound beam by a highly attenuating or reflective structure, e.g., calcification, bone gas. A radiologist demonstrating this understanding correctly attributes the observed shadowing to the presence of gallstones, a common and clinically significant finding. This aligns with the Ransker commitment to maintaining high standards of diagnostic accuracy and patient care, as outlined in their professional practice guidelines, which implicitly require a thorough understanding of imaging physics for accurate interpretation. Incorrect approaches analysis. Attributing the shadowing to a cystic lesion is incorrect because cystic lesions typically cause posterior acoustic enhancement, not shadowing, due to their fluid-filled nature and low attenuation. This demonstrates a fundamental misunderstanding of how ultrasound interacts with different tissue types and artifacts, failing to meet the expected standard of diagnostic competence. Suggesting the shadowing is due to a gas bubble within the gallbladder is plausible but less specific, and less likely to be the primary cause of significant shadowing compared to calcified gallstones. While gas can cause shadowing, the typical appearance of gallstones is more consistent with the described shadowing. This approach lacks the precision required for accurate diagnosis and may lead to further, potentially unnecessary, investigations if not properly contextualized. Concluding that the shadowing is an equipment malfunction is an incorrect assumption without further evidence. While equipment issues can cause artifacts, the described posterior acoustic shadowing is a well-established and predictable artifact related to the interaction of ultrasound with specific biological structures. Dismissing it as a malfunction without considering the physics of ultrasound interaction demonstrates a failure to apply fundamental knowledge and a lack of critical diagnostic reasoning. This approach could lead to overlooking significant pathology and failing to provide a complete and accurate report, which would be contrary to professional obligations. Professional reasoning. Professionals should approach such scenarios by systematically evaluating the image. First, identify the primary finding and any associated artifacts. Second, consider the known physics of ultrasound interaction with different tissues and structures. Third, compare the observed artifact with known artifact types, e.g., shadowing, enhancement, reverberation. Fourth, correlate the findings with the clinical context. If an artifact is suspected, its cause should be explained based on physical principles. If pathology is suspected, its characteristics should be described accurately. When in doubt, consultation with colleagues or further investigation may be warranted. This systematic approach ensures diagnostic accuracy and adherence to professional standards. Question 19. Performance analysis shows a slight but consistent increase in patient-effective doses for routine chest X-rays across multiple imaging modalities within the radiology department, despite no significant changes in patient demographics or pathology prevalence. The department is seeking to address this trend while maintaining diagnostic image quality. Which of the following approaches best aligns with the Australian Radiation Protection and Nuclear Safety Agency, ARPANSA, Radiation Protection Guidelines for Medical Applications? Option A. Reclassify the observed dose increase as within acceptable diagnostic limits and focus resources on other areas of departmental improvement. Option B. Advise all radiographers to independently adjust their personal exposure settings based on their individual experience to achieve satisfactory image quality for each patient. Option C. Conduct a comprehensive review of current imaging protocols for chest X-rays, including examination parameters, equipment settings, and image acquisition techniques, to identify areas for dose optimization in line with ALARA principles. Option D. Increase the exposure factors, KVP and M, as for all chest X-ray examinations to ensure a higher signal-to-noise ratio, thereby improving image clarity and reducing the likelihood of repeat exposures. The correct answer is C. Conduct a comprehensive review of current imaging protocols for chest X-rays, including examination parameters, equipment settings, and image acquisition techniques, to identify areas for dose optimization in line with ALARA principles. Explanation. This scenario presents a common implementation challenge in radiation protection, balancing the need for diagnostic imaging with the imperative to minimize patient and staff exposure. The professional challenge lies in interpreting and applying the Australian Radiation Protection and Nuclear Safety Agency, ARPANSA, codes and standards, specifically the Radiation Protection Series, RPS publications, in a practical clinical setting where workflow efficiency and diagnostic quality are also paramount. The radiographer must make a judgment call that upholds the ALARA, as low as reasonably achievable principle, without compromising the diagnostic efficacy of the examination. The correct approach represents best professional practice because it directly addresses the identified performance gap by implementing a targeted evidence-based strategy that aligns with ARPANSA RPS 15, Code for Radiation Protection in Medical Applications, and RPS 16, Radiation Protection in Diagnostic Radiology. This involves a multifaceted approach, reviewing current protocols, assessing equipment performance, and providing specific training. This proactive and systematic review ensures that the department is not only compliant with regulatory requirements, but also optimizing practice to minimize dose. It demonstrates a commitment to continuous improvement in radiation safety, a core ethical and regulatory obligation for all medical radiation practitioners in Australia. An incorrect approach that focuses solely on increasing exposure factors to improve image quality without considering dose implications fails to adhere to the ALARA principle enshrined in ARPANSA guidelines. This is a direct regulatory failure, as it prioritizes image acquisition over radiation protection. Another incorrect approach that dismisses the performance analysis as a minor issue ignores the potential for cumulative dose increases and the ethical responsibility to minimize all unnecessary radiation exposure. This demonstrates a lack of professional diligence and a failure to engage with the principles of radiation safety. A third incorrect approach that involves anecdotal adjustments without systematic review or data collection is unprofessional and potentially unsafe. It lacks the rigor required by regulatory frameworks and can lead to inconsistent and suboptimal radiation protection practices. The professional decision-making process for similar situations should involve a systematic approach. First, acknowledging and investigating performance data. Second, consulting relevant ARPANSA codes and standards. Third, evaluating current protocols and equipment. Fourth, implementing evidence-based interventions. And finally, monitoring and re-evaluating the effectiveness of these interventions. This iterative process ensures that radiation protection practices are not only compliant, but also continuously optimized. Question 20. Cost-benefit analysis shows that a slightly lower radiation dose protocol for pediatric chest X-rays, while potentially reducing image quality in some marginal cases, would significantly decrease overall departmental radiation expenditure and improve patient throughput. The referring clinician has requested a standard chest X-ray for a 5-year-old child presenting with a cough and fever, with no specific concerns raised about the need for exceptionally high detail. What is the most ethically and professionally appropriate course of action for the radiologist? Option A. Perform the chest X-ray using the standard protocol, ensuring optimal image quality for accurate diagnosis, and document the rationale for not using the lower dose protocol in this instance. Option B. Defer the X-ray and request the referring clinician to justify the need for a standard protocol, suggesting the lower dose option as a default. Option C. Utilize the lower dose protocol to maximize cost savings and patient throughput, assuming the reduction in image quality is unlikely to impact the diagnosis in most common pediatric respiratory presentations. Option D. Perform the chest X-ray using the lower dose protocol, but immediately order a repeat X-ray with the standard protocol if any diagnostic uncertainty arises from the initial images. The correct answer is A. Perform the chest X-ray using the standard protocol, ensuring optimal image quality for accurate diagnosis, and document the rationale for not using the lower dose protocol in this instance. Explanation. This scenario presents a professional challenge due to the inherent conflict between resource optimization and the potential for misdiagnoses, particularly in a field where early detection is paramount. The radiologist must balance the economic realities of healthcare provision with their ethical obligation to patient care, as mandated by the Fellowship of the Royal Australian and New Zealand College of Radiologists, FRANSCR, Professional Standards, and the Australian Health Practitioner Regulation Agency, AHPRA guidelines. The correct approach prioritizes patient safety and diagnostic accuracy, even if it incurs slightly higher immediate costs. This aligns with the FRANSCR commitment to maintaining high standards of medical practice and the principle of do no harm, non-maleficence. It reflects best professional practice by ensuring that all clinically indicated imaging is performed to the highest standard, thereby minimizing the risk of misdiagnosis or delayed treatment. This approach is ethically sound and legally defensible, as it adheres to the duty of care owed to patients. An incorrect approach that prioritizes cost savings over clinical necessity would represent a significant regulatory and ethical failure. Such an approach could violate AHPRA guidelines regarding professional conduct and patient care standards. It could also contravene the spirit of the FRANSCR commitment to excellence in radiology, potentially leading to substandard patient outcomes. Ethically, it breaches the principle of beneficence, acting in the patient's best interest, and could be construed as professional misconduct if it leads to harm. Professionals should employ a decision-making framework that begins with a thorough clinical assessment of the patient's needs and the diagnostic question. This should be followed by a consideration of the most appropriate imaging modality and protocol, weighing diagnostic yield against potential risks and benefits. Consultation with referring clinicians and adherence to established imaging guidelines are crucial. In situations of resource constraint, the focus must remain on ensuring that essential diagnostic information is not compromised, rather than solely on cost reduction.